What is a stricture and IBD diagnosis? Imagine a narrow pathway that suddenly makes it hard to pass through. That's what a stricture is in the context of inflammatory bowel disease. It's a section of the intestine that has become tighter than normal. In inflammatory bowel disease, especially Crohn's disease, strictures form because of repeated inflammation. When the intestine gets inflamed, it tries to heal itself. This healing process can cause scar tissue to develop. Over time, this scar tissue makes the bowel wall thicker and less flexible. The result is a narrowing of the intestinal passage, which can block food and waste from moving smoothly. A strictured area can happen anywhere in the digestive tract, but it's most common in the small intestine. When the bowel narrows, symptoms like bloating, cramping, and abdominal pain often appear. Sometimes, if the narrowing is severe, it can cause a bowel obstruction. That means a complete blockage, which can be serious and requiring urgent treatment. Doctors use different tests to find strictures. Imaging tests like magnetic resonance imaging scans, computed tomography scans, or ultrasounds are essential. They help visualize the bowel and measure how much the passageway has narrowed. Usually, a narrowing of at least 50% of the normal diameter suggests a stricture. The wall of the bowel may also appear thicker, often by 25% or more. Sometimes, the intestine just before the narrow part will be enlarged, which is called prestricture dilation. Endoscopy is another tool doctors use. It involves inserting a flexible tube with a camera into the bowel. If the scope cannot pass through the narrowed area, it confirms a stricture. Sometimes, the doctor can also perform procedures like balloon dilation to stretch the narrowed segment. It's important to tell the difference between a stricture caused by inflammation and one caused by scarring. Inflammation-related narrowing might improve with medicines that reduce swelling. But scarred strictures are less responsive to medication and often need procedures or surgery. For people with sensitive stomachs, colitis, or irritable bowel syndrome, understanding strictures is vital. Symptoms like pain and bloating can overlap, but strictures are a structural problem, not just a functional one. If symptoms worsen or don't improve, medical tests are necessary to check for strictures. Managing strictures may involve dietary changes, such as eating low-fiber foods to reduce stool bulk. In some cases, doctors might recommend endoscopic procedures or surgery to open the narrowed section. Recognizing the signs early and seeking medical advice can help prevent complications like complete bowel blockage. In summary, a stricture in inflammatory bowel disease is a narrowed part of the intestine caused by inflammation and scarring. It's diagnosed mainly through imaging and sometimes endoscopy. Proper treatment can help manage symptoms and prevent serious issues.